Hello class, Teacher Pacific here. How are you? I am doing well. Today's lesson is going to be on community health signs during COVID-19, also known as the pandemic. So COVID-19, you can also hear that as being called coronavirus or the pandemic. So we will look at signs that you may see around stores or buildings and try to understand what they are saying. So the first sign that is very common is this coronavirus health warning. So we will go over the symptoms. So what the word symptoms means is signs that you are sick. So for example, if you have any of these symptoms, you may have coronavirus or COVID-19. So the first symptom or the first sign is a fever. So a fever is when you are very, very, very hot. And we will look at the degrees for a fever. Next is if you have a cough. That is a cough. Next is if you have shortness of breath. So shortness of breath means if you're having a hard time breathing, that is shortness of breath. And the next is a sore throat. So this is your throat. And when it is sore, it hurts very bad. And it hurts when you drink or when you eat anything. So that is a sore throat. Again, the symptoms or signs of coronavirus or COVID-19 are fever, cough, shortness of breath, and sore throat. So the symptom or the sign fever. So the normal body temperature is around 98.6 Fahrenheit. So if they take your temperature and it's 98.6, that means that is normal, so you are not sick. But the Centers for Disease Control and Prevention considers a reading of 100.4 degrees Fahrenheit a fever. So if they take your temperature and you have 100.4, that means you have a fever, and that is a sign for coronavirus. So again, a normal temperature is 98.6 degrees Fahrenheit. A fever is 100.4 degrees Fahrenheit. So this picture, as you can see, is a worker taking the temperature of someone. So this machine reads the temperature and can tell you if you have a fever or not. The next sign you will see is this stop sign that is on the outside of a lot of groceries or buildings. So the sign says, if you have a fever, cough, shortness of breath, or have been exposed to someone with COVID-19, please do not enter the building. Call from outside for assistance. Thank you. So this sign is a warning. So it says stop. And if you have any signs or symptoms of COVID-19 or coronavirus, don't go into the building. And when it says, if you have been exposed to someone with COVID-19, that means if you have been around a friend, a family member, a coworker, anyone who may have had COVID-19, then you should not go in, because maybe you got COVID-19 from being around someone who had it. Okay, so this sign is on the doors of many buildings and many groceries or stores. Next, you will see this sign that says face covering required at all times. So what that means is you have to wear a face mask whenever you go into any building. So anytime you step out of your home, you should always be wearing a face mask. Some stores or buildings will not let you in if you do not wear a face mask. So a face mask must cover your mouth and your nose. So a face mask usually looks like this. Another sign you will see is this notice sign, which says physical distancing in practice. So what that means is you have to stand 6 feet, so FT means feet, away from everyone around you. So you can't be too close. You have to stay 6 feet away from those around you. So an example is here in this store. In a lot of stores, you will see these stickers on the ground. And the stickers say 6 feet apart. So if someone is standing on this sticker, that means you have to stand all the way back here to this next sticker. And that means 6 feet apart. Next, you will see some signs that say, please wash your hands. You should always be washing your hands. So to help stop the spread of germs like coronavirus, you must wash your hands. So let's read this sign together. So number 1 says, wet hands with warm water. Number 2, you apply soap. Number 3, you wash for 20 seconds. Number 4, you rinse hands. Number 5, you dry hands. And then last, number 6, you use paper towel to turn off faucet. So every time I get home from the store or from the office, I always wash my hands, always, for 20 seconds. If you are going into a store and you want to kill some germs right away and you can't go to the bathroom, you can use hand sanitizer. So when you can't wash your hands or after going into a store and you're touching surfaces, use hand sanitizer to kill germs. So these are examples of different types of hand sanitizers. So Purell is what I use a lot, and sometimes I use Germ X. Another sign you may see out in the community is a sign that says COVID-19 testing here. So that means that that place is having or giving COVID-19 tests. Some places you can have COVID-19 tests for free, but other places you may need insurance. So this is an example of what they do when they do the COVID-19 tests. They put a swab up into your nose for the COVID-19 test, which hurts. It is not fun. In summary, so everything that we just went over, to stop the spread of germs and to help prevent the spread of respiratory diseases like COVID-19. So respiratory diseases is like diseases that affect your respiratory system, which is mostly like your chest and your heart and breathing. You must stay at least 6 feet from other people. So social distancing, 6 feet away. Cover your cough or sneeze with a tissue, then throw the tissue in the trash and wash your hands. So sometimes if you sneeze, you can sneeze into your elbow, but it is recommended that you sneeze into a tissue or cough into a tissue. Next, when in public, so when you're outside of your home, wear a cloth face covering over your nose and mouth. So face covering is a face mask. Next, do not touch your nose, your eyes, or your mouth. So when you are out in public and you're touching other things, do not touch your face. Next, clean and disinfect frequently touched objects and surfaces. So frequently means a lot. So clean areas that you touch frequently means clean them a lot. So let's say if you have a friend over and they're touching your stuff in your apartment, you should clean after they leave. Next, stay home when you are sick, except to get medical care. So you should not be going anywhere if you are sick. Next, wash your hands often with soap and water for at least 20 seconds, okay? So wash, 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 wash for 20 seconds. Another disease that is going around during this time is the flu. So the flu is similar, which means kind of the same as COVID-19 symptoms. So the flu has some of the same symptoms as COVID-19 or coronavirus. So with the flu, you also have a cough or a fever, and so sometimes people get confused between the flu and COVID-19. But with the flu, you can get a flu shot, okay? So right now, you can get your flu shot at the clinics in Walgreens or CVS or at your doctor's office. So right now, you should definitely be getting your flu shot. So, in conclusion, get tested for COVID-19 if you feel any symptoms. So symptoms are signs. So for example, fever, cough, shortness of breath. So those are some symptoms. And get your flu shots. So you don't have to feel sick to get your flu shots. You should just get them anyways. Okay, class, have a good day and do not forget to do the survey at the end. All right, class, I will see you next week.